Liposuction of the abdomen involves using a liposuction device and liposuction techniques to remove the unwanted subcutaneous fat from the abdomen. So the fat that you can pinch with your fingers is the fat that I can suck out with liposuction. So how that's done is liposuction of your abdomen can be done with you awake or asleep. If either way, the procedure is done the same way. The only thing that changes is the fluid that we pump in at the beginning of the procedure. So liposuction starts by infusing a tumescent solution that is basically mixes with the fat. You can think of it as fluid that mixes with the fat that we're going to suck out. We let that sit for a couple minutes, and then we use a cannula that breaks up the fat. So the cannula I use vibrates really fast and it kind of shakes all the fat cells loose, sort of like shaking up the sand. And then I go back with a different cannula and multiple different cannulas to get the contour and result that I'm looking for and suck out that extra fat. And then lastly, go back with a cannula off suction that smooths everything out like raking a sand trap. So liposuction of the abdomen is done or performed to remove unwanted subcutaneous fat from the abdomen. The subcutaneous fat is the fat under your skin that you can pinch. And that is what is treated with abdominal liposuction. The incisions for abdominal liposuction are planned behind your bikini or board shorts. Basically, if you bring a garment, underwear, whatever you want to bring, I can plan the incisions to be hidden behind that garment most of the time. And the liposuction incisions are small. They're really small. But nonetheless, we can plan them to be hidden by something. I also like to make them asymmetrical, so I'll purposefully make one side of your body's incision a little higher than the other so it doesn't look so surgical, looks a little more random, so people are less likely to notice your tiny liposuction scars. And then lastly, I usually will put an incision in the belly button because it's a nice hidden spot and it gives me access to your upper abdomen as well. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.